Okay, thank you all for attending today. Our presentation today is going to cover a topic that is developing now as we reopen. Everyone gets back to work, hopefully back to some sort of normalcy after this COVID-19 pandemic that we've all been under. This presentation is from actual workplace situations and input from clients and managers. I'm working with a number of companies involved in this topic right now. So I've seen firsthand the impact that this issue has had on the workplace, managers, business owners, employees, and the business itself. This presentation will be about 25 minutes. After that, we'll give you an opportunity to ask questions. So as I'm going through the presentation, if you'd like to jot down your questions, hopefully we can get through some of them or maybe even all of them. We have a disclaimer for you. This presentation is based on the most available information that we have right now, but that changes daily and sometimes hourly. I even changed one of these slides last week because of a change with CDC. And I'm sure we've bombarded all of you with all kinds of documents and emails and information, probably more than you'd ever want to know. And unfortunately, I think the bombardment's going to continue for a little while. So we appreciate your patience with that, but we definitely want you to be as updated as you can be. Well, we've waited for this and we're open again, or you're in the process of opening. There were a lot of steps that you had to go through to do that and to accomplish your availability to operate as a business that you had in the past. And all of the steps that have been taken, I'll go through them quickly. We've had several Zoom meetings these past few months, and we've talked about some of these steps. We have a great group of human resource consultants and safety consultants that can help you with a lot of these steps if you feel like you're missing them and you need clarification or you just need to start them. You should have done a risk assessment of your facility. You should have a response plan that's designed to meet your business needs and the employees' needs and meets all the regulations from the feds and the state and all the local regulations that have been put in place. Your facility's physical environment might look a little different to employees as they're coming back because you've had to make changes because of social distancing requirements. Your managers and supervisors have got to be trained in the plan and all the regulations that you've put into place. And as your employees are coming back to work, all of them may be there now, or you may still be recalling some of them as they come back. You need to train them as well so they know exactly what the regulations are, what the CDC guidelines are in place so that your workplace stays healthy and safe for everyone. So we're on our way back. Everyone's back, or most of them are back, or they're on their way anyway. And our business is almost back to normal. The copy machine's running. You can hear the forklift in the warehouse going. Customer service phones are ringing. All these sound sites, they just sound great. Or so we thought. Three weeks later, after you've been open, one of your managers gets a call on a Monday morning, and it's from a customer service employee, we'll say. Her voice doesn't sound normal. He feels like there might be something going on. The employee starts to speak. "I guess I won't be in for a while," the voice said. "I was tested on Saturday afternoon, and I just got the report. I tested positive for COVID-19. What should I do?" There is a lump in your throat. A feeling of panic comes over you. It's a call you hoped you would never get. So what are you going to do? We have some steps for you to take to deal with this situation that's developed. We hope that they will inform you and help you through the process. The first thing you're going to have to do is, of course, talk with the employee that's on the phone. You want to express empathy and support to this person. You want them to understand that what you're dealing with, we want to help you. We're here for you. You want to let the employee share their feelings with you. Let them talk it out. If they want to tell you the story, listen to them. These employees are scared, worried, fearful. They're worried about their family, and they're also worried about the employees that they work with, their coworkers. Assure the employee that you're going to respect their confidentiality as much as you can. And as you're speaking with the employee, you want to ask them for their help, because you need some information. You need information about the people that they have been in close contact with in the workplace. What is close contact? Close contact is someone who you have been within 6 feet of or closer, and for 10 minutes or longer while you've been symptomatic or tested positive. 14 days before that is where you would start your count. You want to provide the employee with some information. Tell them that Human Resources will be calling them. Human Resources could be your office manager. It could be an operations manager, whoever provides that function in your company. And ask the person, what can we do to help you? Sometimes you'll get an easy question like, hey, what can you do? I've got a bunch of personal stuff in my desk or whatever. How am I going to get to that? Because I may be out for a while. If that's the case, you tell them, well, how about we box everything up and we'll send it to your home FedEx, something like that. Anything that you can do to make the employee feel comfortable and know that you're there to support them through all of this. I want to review some of the CDC guidelines with you. This chart probably looks pretty confusing to you. Please don't try to memorize everything on it because I just changed it last week. We have this guideline for you. We also have the slides available for you. Please contact either myself or any of your consultants, and we'll be happy to send them over to you. I'm going to talk about the first one on this guide. These are the CDC guidelines that have been put into effect for companies, healthcare workers, anyone dealing with COVID-19 to deal with. All of these guidelines are for someone who has tested positive. In that first column, they have something called a system-based strategy. In the second column, it's something called test-based. It's not necessary for you to remember all this stuff, as I've said before. We can help you. We can walk you through this. The doctors, the providers, the hospitals, healthcare workers, they're all very familiar with these guidelines as well. In this situation, the employee that we're talking to shows symptoms. Maybe she has a fever, maybe she has a cough, sniffles, she's got a terrible headache. The first thing is she needs to stay at home. She needs to be quarantined. When is she going to get back to work? She's going to get back to work. It depends. In the first column, if she's not going to take a follow-up test, then she can't come back to work until her fever is gone and she's not taking any more medications for her fever. And that occurs for a full 3 days, 72 hours. All of her other symptoms have improved, and it's been 10 days since the symptoms first appeared. so she could come back to work at that time. She might be on the test-based strategy side where she's showing symptoms, she's at home, she's gotten her test positive, and then she's going to take a follow-up test. In that case, if she doesn't have a fever and she's not taking meds and her symptoms have improved, she receives 2 negative tests in a row with at least 24 hours between them. And if both of them come out negative, she can come back to work. So you see, a lot of this gets a little involved for you. That's why I'm saying, don't lose sleep over it. There's lots of people that can work and help you through these different categories as to where the employees might fall and how long they're going to be out. We also have people who have no symptoms. They still have to be quarantined because they tested positive. Again, if they don't get a follow-up test, it's the same thing. They would have 10 days that have passed since the first date of the first positive test, and they don't have any symptoms at all since that time. They could come back to work. Or they're on that test-based where they do get a follow-up test. They can return to work as long as they get 2 negative tests in a row, 24 hours apart. Again, the healthcare providers know what all the guidelines are, and they will work with the infected person to guide them through that and let them know when they come back to work. I had one situation with a client, and I want to tell you about it because it's really crazy. They had a person who tested positive. They were quarantined at home. They were seeing their physician, and the physician gave the employee a note and said, hey, you can go back to work now. 7 days have expired. The employee called the client, and the client went, whoa, wait a minute, 7 days? Where did they get to 7 days? And the employee said, well, I have a note from the doctor. And the client said, you mind if I give your doctor a call? He called the doctor. He had our guidelines, and he read all the stuff, and he saw that it was 10 days, not 7 days. When he called the doctor said, let me check on that. And the doctor was wrong. So as you can see, there can be a lot of confusion in all of this. So I thought that was an interesting situation, and the client and I kind of snickered about it. But let's talk about these close contact people, the people that this employee had close contact with at work. What about these folks? These folks show no symptoms whatsoever. But because they had close contact, they're going to have to be quarantined for 14 days, and we'll talk about them down the road. When can they return to work? They can return to work when there are no symptoms appearing and their quarantine is over at 14 days. Some of this might seem a little confusing, and you might say, how come the person that has no symptoms and just had close contact is stuck being out 14 days when some of these other people might come back sooner? That's because the people who tested positive and had symptoms and maybe were infected, they're going through the process and they're getting better and their symptoms disappear. And we know once they're done with the virus, they're finished. However, these people who had close contact, they don't have any symptoms yet. And it could take a full 14 days before they show up. So that's why it's very important for them to fulfill the 14 days, and might be a little different from the folks that had been infected.